Hi to everybody. Thank you for being with us this evening, and it's a pleasure to be speaking about COVID-19 infection and urticaria. I'm from Dermatology Department, Koç University School of Medicine, Istanbul, Turkey. So let's start with the definition of urticaria. What is urticaria? I'm sure you are already familiar with this disease. And it takes its name from this plant called Urtica dioica. When the skin comes in contact with this plant, then you have wheals and itchiness on the skin, and these wheals are called urticaria. Urticaria is a disease, and it is characterized by recurrent wheals as well as swellings on the lips, on the eyes, or sometimes on the hands, on the deeper tissues, and it really gives a lot of burden to the patient. These patients have difficulties in sleeping, in working, concentrating in school activities, and they are isolated, they have social difficulties, and so it's really a burdening disease. And we call it acute urticaria when it lasts shorter than 6 weeks, and we call it chronic urticaria when it lasts longer than 6 weeks. But why does urticaria occur? It occurs because of this angry mast cell. So the key cell is the mast cell, and mast cells are activated in urticaria disease, and they release a lot of mediators. The main mediator is the histamine. You can remember this name from the drugs, antihistamines, because they are the golden standard of treatment. And these histamine and the other mediators lead to dilatation, broadening of the vessels, and then some part of the blood leaks from the vessels to the tissue, and then we see elevations or edema on the skin, and also itchiness presenting as urticaria and angioedema. But what activates the mast cell? Here you see the mast cell and very colored structures on it. These are called the receptors, and these receptors can be activated by many factors such as stress, infections, hormones, pseudoallergens in the foods, drugs such as aspirin and non-steroidal anti-inflammatory drugs, and associated diseases such as autoimmune thyroid disease, gastritis, or sometimes cholecystitis. But what about the infections? The role of infections in urticaria is discussed for more than 100 years, and it is commonly implicated in children with acute urticaria. For example, in children, infections were identified in almost 60% of acute urticaria cases, and the most implicated infections were the viral upper respiratory infections or gastrointestinal tract infections. And there are many viruses that have been associated with urticaria. You see here the yellow urticaria associated with hepatitis A, B, or C viruses. And it's interesting, there is an interesting study that shows the seasonality of several respiratory viral infections with acute urticaria seasonality. So it really suggests a potential linkage with the viral infections and acute urticaria. Coming to chronic acute urticaria and bacterial infections, this is not so strong as viral infections, but cystitis and tonsillitis have been found associated with acute urticaria, as well as some parasites such as sea fish nematode called Anisakis simplex has been associated with acute urticaria. And when acute urticaria is associated with infection, then the probability of it becoming chronic urticaria has been reported to be high as 20 to 30% of children. And infections and chronic urticaria has also been debated, and many bacterial infections. Most are related to gastrointestinal tract, such as Helicobacter pylori. Dental infections or ear, nose, and throat region infections has been implicated in the etiology. But the association of viral infections with chronic urticaria is weaker. So although the prevalence of infections do not differ in chronic urticaria compared to general population, there is some evidence that demonstrates benefit after eradication of infectious processes. And the European Allergy Immunology Guideline on urticaria suggests to treat infections if they are even found in chronic urticaria patients. But how does infection cause urticaria? So as we mentioned earlier, there are receptors on mast cells, and these receptors can be activated by the virus itself or the viral particles or the antibodies that has been produced by the virus. But minority of acute urticaria becomes chronic. But who are the ones who become chronic? The answer to this question is not known currently, but we can hypothesize that patients who have antibodies to their self-antigens, self-proteins, or patients who has abnormalities in mast cell, in their mast cell signaling pathways, may be the ones who have chronic urticaria. So we mentioned the role of infections in urticaria, and we saw that mostly acute urticaria is associated with viral infections. And what about COVID-19 infection and urticaria? So I'm going to answer 4 questions for you. The first one is, how does urticaria manifest in patients with COVID-19 infection? The first manifestation can be acute urticaria, or we can have a chronic urticaria patient and we can have an exacerbation of pre-existing chronic urticaria with the COVID-19 infection. We have experienced that we have seen many patients with COVID-19 infection, and we observed that these patients have many wide range of cutaneous manifestations, and urticarial pattern is the second most common presentation in these presentations. So in a report which evaluated the acute urticaria associated with COVID-19 infections, revealed that 10% of urticaria developed before COVID-19 symptoms. That means that COVID-19 infection can present as only urticaria and can come to our clinics with only acute urticaria. And we also learned from this paper that urticaria disappeared or improved in most of the cases in less than 1 week. And the other good news was that all the patients responded very well to treatment with antihistamines or short courses of systemic steroids. So what happens when a chronic urticaria patient has COVID-19 infection? To answer these questions, we performed a project with a study among UCARES globally and tried to answer some questions, tried to understand what happened in the COVID-19 pandemic to chronic urticaria patients and their physicians during the pandemics. Since this study was just at the beginning of the pandemic, we only had 79 chronic urticaria patients who experienced COVID-19 infection, and we saw that we observed that chronic urticaria, if a chronic urticaria patient has COVID-19 infection, then these patients, 37% of these patients may experience exacerbation of chronic urticaria. And the exacerbations of chronic urticaria were more common in patients who had severe COVID-19 infection, likewise in hospitalized patients. So does COVID infection manifest as severe infection in chronic urticaria patients? The answer to this is no, because in our study, COVID-19 infection showed a mild course in 96% of the patients. Do treatments of urticaria interfere with COVID-19 infection? And I can say to this question as no. Here you see treatments at time of COVID-19 diagnosis in these 79 chronic urticaria patients. Most of them were on antihistamines, 1/3 were on omalizumab treatment, and 2.5% was on cyclosporin treatment, and there was no statistically significant relationship between chronic urticaria treatment and COVID-19 severity. And the European Allergy Immunology group suggests to withhold omalizumab treatment only in severe COVID-19 infection and continue omalizumab treatment if the COVID-19 infection is with mild symptoms, if the urticaria is severe in patients. Omalizumab can even be beneficial. It's interesting but true because omalizumab enhances antiviral immunity by increasing interferon alpha levels. And while the patient is on immunosuppressive treatments such as cyclosporin A or systemic steroids, then it is better to withhold these treatments if the patient is having COVID-19 infection. As a conclusion, COVID-19 infection doesn't show a worse course in chronic urticaria patients, but infection with COVID-19 results in chronic urticaria exacerbation in 1 of 3 patients. Treatments of urticaria do not interfere with COVID-19 infection. Continuing urticaria treatment is critical to keep urticaria under control during COVID-19 infection. And avoiding infection by the vaccines is recommended for chronic urticaria patients. And now we will listen to our colleagues on vaccines and chronic urticaria. Thank you for your attention.